Vaccine hesitancy is on the rise worldwide, so much so that the World Health Organization has identified it as one of the top 10 threats to global health in 2019. Since the 1950s, vaccines have helped protect millions of people against diseases like polio, meningitis and hepatitis, and new ones continue to be developed all the time, most recently helping to protect thousands of people against a deadly Ebola outbreak in the Democratic Republic of Congo. But while vaccines have become ever more effective and widely available, not everybody wants them. Global health advocates say this is threatening to undermine this hard-won progress and is leading to a resurgence in vaccine-preventable diseases. So what's going on? Vaccine hesitancy isn't new. Resistance to vaccines goes as far back as the 19th century and the first vaccine developed against smallpox, when concerns circled around safety and state intervention. Today, similar concerns continue to exist, but now it's aggravated by a growing distrust in authorities and new technologies that allow misinformation to travel faster than ever. The most visible part of this is the so-called anti-vax movement, a growing group of people who reject the science behind immunisation. This has hit the headlines, particularly in higher income countries. Both the United States and Europe are currently dealing with their biggest measles outbreaks in 2 decades. But vaccine hesitancy isn't just about an explicit rejection of vaccination. Far less reported, it's also about people who just don't want to get vaccinated, either because they think they don't need to or because they see it as too inconvenient. Nor is it limited to higher income countries. In Pakistan, the government recently suspended a polio vaccination drive after rumours spread on social media about polio drops being harmful, leaving frontline health workers vulnerable to attack. 1 health worker and 2 police officers were killed amid the panic. The growth in international travel has also increased the risk of these diseases spreading across borders. In February, an unvaccinated tourist from France is believed to have reintroduced measles to Costa Rica, which hasn't had a domestic case of the disease since 2006. In Nigeria, which is struggling with a yellow fever outbreak, Devex found false immunisation documents on sale at the airport for about $8.50, enabling tourists to travel abroad without actually having been immunised. The World Health Organization has stressed that vaccine hesitancy, which it defines as the delay in acceptance or refusal of vaccines despite the availability of vaccination services, isn't the only reason for low levels of vaccine coverage worldwide. In some places, vaccines still simply aren't available or are too expensive and difficult to access for most people. But there is a growing awareness in the global health community that the issue of vaccine hesitancy requires attention. While most aid-funded vaccine efforts to date have been focused on the supply side, that is, developing and buying vaccines and getting them to people in lower income countries, perhaps not enough has been done on the demand side, which means making sure that people actually want vaccines and are willing to accept them once they're available. Advocates say that needs targeted strategies for education, understanding how people process information about vaccinations, and making sure that the same technologies that are used to spread misinformation are also used as a force for good, reminding people that they need to get vaccinated and explaining why it's important. Some development groups are trying to tackle the spread of misinformation on social media, for example UNICEF's recent Vaccines Work #campaign. But even so, many practitioners feel that social media companies aren't doing enough to stop the spread of misinformation. How do you think the global health community can tackle the rise of vaccine hesitancy? Leave a comment below or follow our stories on Devex.com, where we're exploring the rise of vaccine hesitancy around the world.